And KIMT News 3 is also tracking the number of hospitalizations in each state. According to the Minnesota Department of Health, there have been 242 people hospitalized with coronavirus in the state. 120 of those are still hospitalized today. 64 are in ICU. With those numbers expected to peak in Minnesota this week, KIMT News 3's Raquel Hellman is finding out how area hospitals are preparing to handle a likely surge in patients. She joins us live from Mayo Clinic in downtown Rochester. Raquel.
Yeah, George, I was actually tested for COVID-19 just 1 week ago, and I'm happy to say my test came back negative, but of course that means I could still get the virus. And if I was to come here to be treated at Mayo, I want to know what kind of care I can expect to receive. And as the number of cases in Olmsted County surpasses that 100 mark, medical staff here at Mayo Clinic are preparing for a surge in patients in the coming weeks, as Minnesota has not yet reached the acceleration point or the peak. So I asked an infectious disease expert here at Mayo how they're making sure they're ready. He tells me their strategy is to maximize their conventional care.
How do we keep doing what we do on a normal basis, but maximizing that and optimizing that so we can take care of as many patients as possible? And then we move into contingency plans, is that if those conventional approaches are not sufficient, then what else can we do while still maintaining the normal standard of care?
Yeah, and he tells me they have been preparing for a pandemic like this for years, and it all comes down to maximizing 3 resources. That's staff, space, and supplies. Now, one way they're doing that is by taking those resources out of low priority areas, for example, elective procedures, and taking those resources, moving them to the high priority areas that are dealing directly with COVID-19, like the emergency room. Live in Rochester, Raquel Hellman, KIMT News 3.
We really are talking about the front lines. Thank you, Raquel. As we first told you last week, Mayo Clinic has been designated as the leading institution in the nation for a program that would collect blood plasma from people who have recovered from COVID-19 and then use it to treat others who are suffering with the illness.
Food assistance remains a top priority for